You're watching Beyond Markets. Welcome. I'm Esther Awoniyi. Many thanks for joining us. On today's show, we'll discuss how Africa can move ahead in healthcare delivery to improve outcomes. You can join the conversation using the hashtag Beyond Markets. You can also send your thoughts, your comments to my Twitter handle too. It's at Esther O. Awoniyi. Now, meeting healthcare demand in Africa is no easy feat, being the second most populous continent with the greatest deficit in healthcare infrastructure. But as countries in the region race to meet the targets set for the Sustainable Development Goals by 2030, Eyong Ebai GE Healthcare's General Manager for West, Central Africa and French Sub-Saharan Africa joins me today as we explore ways to get better health outcomes on the continent. Very ambitious targets under the SDGs for health, related outcomes. And what I've found out and what health experts have told me over the years is, look, yes, these are very ambitious but good targets for us under the SDGs. But for Sub-Saharan Africa, for the African continent, healthcare spend is still very low. And that continues to be a challenge. But from where you're sitting, share your perspective on where we are as a continent. Perhaps even as a country in terms of how we're meeting the SDGs and what are those challenges?
Sure. So, there's a number of SDGs, but there's one in particular that GE is very much focused on, which is SDG 3. And that's the SDG that's focused on health and well-being. So if you look at the key sub-goals under that SDG, you've got things like reduction in maternal mortality. You've got prevention of early death, so newborn and under 5 infant mortality. How can we impact and reduce that? And then the third sub kind of heading under that SDG 3 that is of great interest to GE is also the universal healthcare. So attaining universal healthcare coverage by 2030. So,
but for you, what are those challenges that you see day to day across the continent?
Yeah, so look, primary healthcare is a big area or a big gap in regards to current provision. What you're finding in many of the regional African countries is primary healthcare not really working, the infrastructure not being there, technology not being available, and therefore patients are going straight to secondary or tertiary care, and they're causing congestion at tertiary and secondary care. So for us, if you can address primary health care, you can reduce the flow of patients to secondary and tertiary care, and you can catch disease early and reduce the cost of treatment.
I think one thing that's pretty clear that we've seen over the years and we continue to see is that public sector funding, obviously has constraints, and of course there's always our focus and there's always a call for private sector, that handshake between the public government and the private sector on the public-private partnerships. And even in healthcare, so I think there used to be this belief that when it comes to healthcare, that's just the purview of the government. Government has to provide. It's one of the basic, human, social services that governments should provide for their people. But that is changing now, and I think it's become even more clear. If you look across the budgets of many of these African countries on the continent, there are serious constraints. And even though many of them try to make healthcare a priority, the money is just simply not enough. So let's talk about the private sector side of things now in terms of how we're seeing that handshake between public and private sector. What are the what opportunities does the private sector see, and how would what kind of conducive environment, in your opinion, should these governments provide to make way for those investments to come in?
Sure. So, I think the only way that you can reduce or improve the indices in regards to patient outcomes across the region. So just to kind of go through a couple of the statistics, we have 11% of the population, 24% of the disease burden. Currently, there's only 1% of global healthcare spend is within Africa. If you look at the region that I look after, it's approximately kind of 45% of the landmass of the continent. And if you look at some of the indices, 11 of the worst performing 20 countries from a life expectancy point of view, 13 out of the lowest 20 globally in regards to infant and child mortality. So there's a huge amount of work that needs to be done within the healthcare infrastructure and the healthcare space. And really one of the key ways of being able to address that is through PPPs and PPP models and innovative solutions that can try and address that. And so there's things that you can do, PPP at primary healthcare level as well as at specialist care. And GE has executed a number of programs where we've partnered at a primary care level. Yeah, so Health Imaginations is a good example where GE partnered with the Nigerian Ministry of Health, the Nigerian Primary Healthcare Development Agency, MPHCDA, and we rolled out a program targeting maternal health or maternal and infant care, where we deployed 125 vScan accesses across 4 states in Nigeria. Alongside that, we had task shifting education programs that we ran with midwives as well as with healthcare professionals that operated in the primary healthcare settings. And that's a nice kind of PPP where you're working with local communities in the state level, with the Ministry of Health as well as with the development agency in primary healthcare.
I know many times we've talked about, finding the right model, across the continent or from country to country. In your experience, going, from West, Central, French-speaking Sub-Saharan Africa, how different is one model to another? What are those differences that you see?
Look, there isn't really a right model. If you, again, just reflecting on the indices that I just described, there's so much to be done, and there's different ways that can be done. And each country or each state, each region has its own nuances and its difference. And that's essentially why healthcare is devolved to a local level, be it a state or be it to district level. So I think, what we've done is focused on the different markets or the different districts or the different states and come up with solutions that meet the need of that state.
Let me take you back to the Health Imagination, that's the Mother and Child Initiative. Just the experience of that particular project, going into it as an investor. How would you describe how you were received, the part of the government, how they were able to meet their own side of whatever it was, their own side of the bargain? And I imagine if you're bringing this infrastructure and you're bringing these services, I'm wondering, what about training? Because it's people who are going to make use of. So did you also have to do that?
Sure. Training is absolutely fundamental to everything that we do, actually, in all the levels of the work that we engage in. So with the Health Imaginations program, yes, there was technology, which was the vScan Access, which is a handheld ultrasound. But alongside that technology, there was a robust training program, capacity building program to ensure that the people that were handling that tool were able to utilize it in the most effective way and were able to interpret the information that tool gave them. And then from a task shifting point of view, so again, with the lack of clinical personnel, it was important that you empowered not just the midwives, but you also empowered and shifted tasks to medical officers so that you could get the coverage and the range. And your question around how was it received? Clearly very well, very positively, because the type of work you're doing is very impactful and touches a lot of lives. That primary healthcare, bottom of the healthcare pyramid, has a big impact across communities in the number of people that you touch every day when you work in that space.
I'm just trying to understand, because for some investors, when they go in, they're not particularly sure what they're going to meet or have to contend with. When you went in, did you have to start from zero? Meaning, did you go in and realize, oh wow, these people need more than, perhaps there are enough things that should typically be at the basic level in a primary healthcare center? Did any of those things come up?
Yeah, prior to the program, there's a lot of feasibility that goes into them. So there's a lot of work that we do where we talk to the communities, talk to the development agencies.
Okay, so you already get a sense of, what's missing and what's... And quickly, just a brief diversion. Also, we know that donors are also part of the mix here. And what we've been hearing also is that we're seeing donor fatigue. In your experience, is that something that's happening? And do you see it getting worse?
Look, I think there's, donors around sort of their priorities are shifting and changing. And also there's a need for countries to also take on responsibility for the development of their healthcare systems. And I see a lot of donors actually supporting that way, because that's the way you get to a sustainable model. So what you're seeing is donors and NGOs working hand in hand with development agencies and organizations like GE, so that we can build solutions that have impact but also are sustainable. Because I think the old way of coming in for 1 year or 2 years, and then once the funding is dries up, the whole program stops. We're trying to move away from that, and I believe that the solutions that we're developing, we have an eye on, can this be sustained over the long term by the agency that we're executing the program with.
Now, keeping an eye on the future, I'm just looking at some stats from the International Finance Corporation, and it says that over the next decade, between $25 to $30 billion in new investments will be needed to meet Africa's healthcare demand. And it always stresses the fact that not just, all the other Brentwood institutions always stress the fact that, look, there's still this ample opportunity for investors. But I'm just wondering, typical investors who are perhaps coming in for the first time, even those who are already on the continent like GE, what are those specific barriers that you believe should be taken out for better synergy, for you to come in and properly put in a good PPP structure? Yeah,
look, I think we look at less around the barriers, more around what the opportunities are.
Okay.
And I think the engagement that we have with governments, be it state or be it federal, are very promising and very open. And we have a number of programs where we've worked with state or governments where we've been able to build solutions that have impact. So I think it's how you enter the dialogue, enter the discussion with the stakeholders, do your homework, do your feasibility to make sure that the solutions that you're providing have merit and have evidence. And again, you see that in programs that we've run. So in Ghana, we've run the VScan program in Ghana.
Okay.
That program, was focusing on 125 districts across Ghana. I think the actual number is 212 districts, 125 districts, where we deployed 500 VScan accesses across the nation. We built capacity, we trained. And that was in collaboration with the Ministry of Health and the Ghana Health Service. So I think focusing on barriers, I think is not necessarily the place to focus. It's how do you engage with the different stakeholders that can impact. And I think GE has done a very good job of doing that with the stakeholders in government.
Okay, Eyong, I must thank you for your time so far. We're just going to pause here, take a break, and come back and pick up from where we left off. I've been speaking to Eyong Ebai. He's a GE Healthcare's General Manager for West Central Africa and French Sub-Saharan Africa, looking at how to achieve better outcomes in Africa's healthcare system. If you're just joining us, Eyong Ebai, GE Healthcare's General Manager for West Central Africa and French Sub-Saharan Africa, is our guest today on Beyond Markets, and we're discussing ways to improve health outcomes on the continent. Eyong, thank you for your time so far. Let's get back to some of the other specific projects that you're working on as a PPP with the government here. One is the partnership with the Nigeria Sovereign Investment Authority, the NSAA. Talk to us about that.
Yeah, no, this is a really interesting and very important partnership, but also kind of like a milestone in regards to oncology care within Nigeria. So Luth alongside Varian plus the NSAA and GE came into a partnership to provide cutting-edge, state-of-the-art radiotherapy technology for treatment of cancer. And why this is quite interesting, it's, for me, it was one of the first times we've seen, two equipment technology providers working within a teaching hospital with, sovereign investment funds to deliver, a state-of-the-art facility. And what you now have is an option for Nigerians to access radiotherapy treatment. GE's role to play was in particular with the first in country CT simulator called Discovery RT. And just briefly around what does a CT simulator do? So you need to be able to identify the tumor, the size of it, and the location of it for you to be able to deliver the right kind of radiotherapy for it. And our CT simulator that we deployed there is, as I say, the state of the art. So that allows you to be able to treat more effectively. So you've got a nice partnership there, delivering a solution that, first in country on the variant side and first in country on the GE side.
Now, many hospitals, especially here in Nigeria, obviously want to be able to use state-of-the-art healthcare infrastructure to treat patients. But we know that many of this equipment can be quite expensive. And but, I mean, nevertheless, many of them are quite necessary to treat, and especially in diagnostics. I know that GE, this is something you also have your hands in, financing. Talk to us about that part.
In regards to financing, it's one of the biggest issues in healthcare. And in GE, we have a dedicated team that's looking at healthcare financing. And they work very closely with the rest of the organization in funding projects that we develop. So recently, we've signed an agreement with Access Bank. And that agreement is targeting mainly small and medium-sized healthcare providers to be able to access competitive loans for technology and equipment to be deployed within their facilities. And I think that partnership is an interesting development in regards to how we can support smaller organizations in regards to funding.
Is this something that, I mean, that you looking to expand considerably going forward? If it does, work out?
Yeah, sure. I think it's an important development in how can we partner with financial institutions to provide the health economy with competitive solutions. So I think it's definitely something that we would like to expand, and not necessarily just in Nigeria, also expand in other countries in the region.
Now, speaking about technology, we've also seen technology playing a very big role in terms of the kind of equipment that we're seeing these days and how it's perhaps helping us to leapfrog when it comes to some of these health outcomes that we talk about. Just speak to that point, the kind of technology we're seeing that's different from what we've had before, and how maybe perhaps specifically it's actually helping us to have better outcomes. Yeah,
look, I mean, we have a product called the Revolution ACT. This is a product that was developed in India, and it was developed for low resource economies. And some of the key difference in that product is its energy supply is a lot less. The lands or the space that's required from a room point of view is a lot smaller, and it's far cheaper to actually run over a period of time. And the entry point for that equipment also is lower. So it's an example of how you can take cutting edge technology, package it for this environment, and deploy it. And it's one of and it's a very good product, and it's doing a lot of good things across the region.
For Sub-Saharan Africa to achieve its sustainable health-related sustainable development goals, these PPPs that we're seeing across the region that appear to be working out well, governments showing more commitment to work better with the private sector also not focusing on those barriers but focusing on the opportunities, as you said earlier. Would you say that that could help the continent move the needle in terms of achieving its SDG healthcare-related targets?
Sure, definitely. And I think that PPP is the key way forward in regards to kind of bridging the gap and improving indices. So working with governments and other organizations, looking at the specific needs of those countries and those communities that we're servicing is really the way forward. So a good example would be like the Shell Olabiri project, which we recently handed over to the Shell organization. That's a PPP model looking at the entire determinants of health. So it's not just looking at infrastructure, it's also looking at things like education, water, power, and taking a holistic view alongside some supply side engagement as well in regards to insurance.
Okay.
So there's a health insurance program that's running alongside it. And again, that's an example of how you take a holistic approach with a technology partner, with an organization like Shell, alongside the local community to develop a holistic, sustainable PPP model that impacts on lives.
I mean, I'm just wondering, the ones we've talked about so far are the ones, and then one in Ghana, but mostly in Nigeria. I mean, for the regions under your purview, I'm just wondering how much more of these projects are going to continue to run, and how much, I mean, in terms of from a commitment point of view for GE, I know that also you're obviously providing the infrastructure, but how many more of these projects are you looking to execute?
So look, we're constantly discussing with partners in how we can impact on the region in regards to projects. So look, I think there's a continual discussion looking at different aspects, be it primary healthcare, secondary care and tertiary care. So there isn't a definitive number. We're having ongoing discussions and ongoing dialogue and how we can...
How does all of that fit into your Africa strategy in terms of, I mean, the regions under your purview also, how does that fit into your strategy for how your, I mean, value, from perhaps also from a value proposition point of view, how that fits into your strategy?
So look, I mean, across Africa, the strategy is similar across the regions. We just deploy based on the kind of local content and the local requirement. So primary healthcare is a key focus across Africa. District hospitals, general hospitals, oncology is a clear focus for Africa. So I think we take the overall Africa strategy and then deploy based on the local need.
Okay. Well, I mean, how optimistic are you? We have about 2-3 minutes left now. How optimistic are you in terms of how Africa is going to begin to develop its healthcare systems? And I'm hoping, and I mean, it's good to see what GE is doing to hear the private sector side of things, to see the willingness and the commitment on your part to foster these partnerships with the government. But are you optimistic that we'll see more of these handshakes, not just even with GE, maybe other companies, other private investors within and outside of the continent also coming in to jump on this bandwagon and help Africa achieve its healthcare outcomes? Yeah,
look, I'm very optimistic, and if you look at what GE has done on the continent in regards to localization, we're here for the long term, and we wouldn't, essentially wouldn't be here for the long term if we weren't optimistic about the future. So I think you've seen a lot of development over the last few years, and I think we can see that continuing into the future. So I think we're very positive, we're bullish. I think we're seeing good impact happening in the projects that we've been working on, and we'll continue to try and develop those projects over the coming years.
Now, from one project to another across the continent, is there one project that stands out for you, perhaps in terms of impact, or just something about that project that just basically stood out for you?
Look, I mean, it's difficult to pick one. I think the work that we're doing at primary healthcare level, the Health Imaginations, was years ahead of a lot of things that were happening. The work that we've done in Ghana with the V-Scan program, again, that's been very impactful. And then recently with the oncology at the other end of the spectrum, where you're looking at specialist care, oncology specialist care, that work also has been very impactful. I've
been speaking to Eyong Ebai, GE Healthcare's General Manager for West Central Africa and French Sub-Saharan Africa. That's it on Beyond Markets. Thank you so much for being a part of it. Remember, you can watch all previous episodes of the show on our website at cnbcafrica.com. You can also stay engaged with the hashtag Beyond Markets. You can also send your thoughts, your comments to my Twitter handle too. It's at Esther Awoniyi. For myself and the team, it's bye for now.